Hi there. Welcome to this program, Your Doctor in COVID. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today, as usual, I will start off by showing you how I wear my mask to cover both the nose and the mouth, and I will not be seen wearing it under my nose usually, and almost never will you see it on my chin unless I'm taking it off. Today, I will wear it off because there's no one else around me, so I pose no risk or danger to anyone, and no one is here to put me at risk personally. So if you have questions, you can send them to us on WhatsApp at 620-MASK, or that's 620-6275, or send us emails at docandcovid@gmail.com. That's docandcovid@gmail.com, all lowercase. So we're starting to get more participation from persons listening or viewing this program, and the questions are coming in, and I'm very pleased to try and answer some of these. So the first or the second question that we'll be answering today is that from a colleague of mine from way back in a different field. And here is the question, or here's the scenario rather. I am 62 years old and work in an air-conditioned room. Other persons visit the room, frequently without mask. I find it difficult to wear a mask all day at work. Now here are the questions. Am I at risk if someone with COVID-19 comes into the room? That's the first question. Is it safe to be in an air-conditioned room and people entering without a mask? If they do enter with a mask, is it safe? Now these are some very, very important and pertinent questions, especially as our workforce returns to work and many persons are working in air-conditioned environment, and this may be a concern. Now if you look at this from a more broad perspective, we have to consider the whole concept of ventilation. Ventilation is the intentional introduction of fresh air into a space while the stale air is removed. It is done to maintain the quality of air in that space. We look at what the authorities' position on this is, and for the purposes of this particular issue, we will rely heavily on the position of the World Health Organization, or the WHO. Now the WHO says heating, ventilation, and air conditioning systems, collectively these are referred to as HVAC. These systems are used to maintain indoor air temperature and humidity at healthy and comfortable levels. A well-maintained and operated system can reduce the spread of COVID-19 in indoor spaces by increasing the rate of air exchange, reducing recirculation of air, and increasing the use of outdoor air. So a lot of these HVAC systems, or all of them, should have a mixture of outdoor air as well as recirculated, filtered indoor air. And these systems are designed in a way that these outdoor and indoor air are mixed, filtered, heated or cooled, and then released again into that particular room. So there is a fair mixture, oftentimes a 50-50 ratio of outdoor air and filtered, recirculated indoor air. So the recirculation modes, according to the WHO, which recirculate the air should not be used. That is, only the modes that can allow mixture of outdoor and indoor air, those are the ones that are recommended. So if you're only using the mode that recirculates air that is already in the room, that is not recommended. The HVAC systems should be regularly inspected, maintained, and cleaned. Again, we're going with positions espoused by the WHO. If the air conditioning or ventilation system is not well maintained and operated, there are two potential mechanisms through which it could contribute to viral transmission. The system itself could recirculate contaminated air, and this is the reason why they recommend systems that mix outdoor and indoor filtered air. So the system itself could recirculate contaminated air, and or it could create conditions which support the survival of the virus. And these conditions are dependent on the temperature of the room as well as the humidity. So that can contribute to the virus growing or surviving and then being passed on from one person or from the room to a potential victim or potential patient. Buildings that use a central ventilation or climate control system should use the most efficient filters. Consider installing a higher efficiency filter, that is the MERV 13 to 16, or in healthcare facility, a HEPA filter which captures viruses effectively and where the air handler is rated for such a filter. A HEPA filter means high efficiency particle air filter. Okay? And filters should be installed and maintained according to manufacturer recommendations. Deviations from this can have malfunctioning and contamination. High efficiency filters are also available for residential use. If you live in a home that you have a lot of visitors and you entertain a lot of persons, you may want to consider having high efficiency filters for your air conditioner, especially if persons or strangers are entering in and out of your home at frequent times. These HEPA filters, basically they look, I don't know if those of you know what an accordion looks like. They have these multiple planes that each one serves to have a filtration or an additional filtration process from beginning to end for this virus and other particles as well. The WHO position is to reduce the number of days that SARS virus can remain viable in an indoor environment. One must avoid setting the climate control system to too cold. That is temperatures below 70 degrees Fahrenheit or 21 degrees Celsius, or too dry, which is a low humidity setting below 40%, as these are optimal conditions for the virus to actually survive. So you don't want it too cold and you do not want the room too dry. In summary, air conditioning, ventilation, or other climate control systems that are well maintained and operated should not increase the risk of virus transmission. So our question where we started out to say, you know, this person works in an air-conditioned room and lots of people can come into this room with or without mask. Are they at danger? So the danger really is the persons coming in and out of the room without mask. It is not dependent on the air conditioning system per se, but the actual people coming in and exposing the occupant of the room. In fact, some properly run HVAC systems or air conditioning systems where the filters are well maintained, etc., those are actually helpful in preventing persons who are in the room from becoming infected, because they will filter the particles and mix the air with outdoor and indoor recycled filtered air. So it may be protective once the system is properly maintained and filters are cleaned. So quite recently, we have opened our airports, and I'm pretty sure the next batch of questions may ask about the risk of air travel or aircraft travel when one considers transmission of COVID-19. But before we get to that, let's look at the other common ventilation equipment that we use in Guyana, which is fans. And what is the WHO position on the use of fans? If the use of fans is unavoidable, increase the outdoor air exchange and minimize air blowing from one person directly at another. And this should be taken to reduce the potential spread of any airborne or aerosolized virus. So in other words, if you're going to use a fan, it is advisable that you also open a window, open a door, make sure that you have outdoor air mixing with the room air that you are circulating with the fan. Okay? So this big question about aircraft, what is the risk really of contracting the COVID-19 infection while traveling in an aircraft? And some airplanes have cabin air filtration systems equipped with HEPA filters. That's the high efficiency particulate air filters, which can remove viruses and germs quickly, minimizing the duration of exposure to any potential infectious materials produced by a cough or sneeze. The cabin air system is designed to operate most efficiently by delivering approximately 50% outside air and 50% of the filtered, recirculated air from the cabin. Therefore, the air supply in an aircraft is essentially sterile and particle-free. Of course, to minimize and reduce the risk of infection while traveling in an aircraft, despite all of the advanced filtration systems that are in place in these aircrafts and airplanes, one must continue to look towards maintaining a safe physical distance. In an aircraft, it's about 1 meter or 3 feet whenever possible. And of course, practice frequent washing of the hands or hand hygiene. And oftentimes you may find persons using the alcohol-based hand sanitizer. We may have some restrictions on the larger size being taken into aircraft still. And so perhaps if this is what you prefer to use, you may want to get the smaller bottles of hand sanitizer to take onto the aircraft, so you could wash or you could sterilize your hands as often as possible while you're continuing to wear your mask. Remember, in the aircraft, even though you may not be subject to air transmission of the COVID-19 virus, you are also going to be touching surfaces on your way to boarding the aircraft or disembarking. When you're sitting down on the seat, for example, you may want to bring down something from the overhead compartment. These are all potential areas that your hand can become contaminated, and then you'll touch your face, etc., and put yourself at risk. So frequent sterilization of the hand or washing of the hands using the hand sanitizer is actually recommended, along with your face mask and maintaining social distance. Remember, if you have any questions or comments for this program, feel free to send us on WhatsApp at 620-MASK. That's 620 6275 or email at docandcovid@gmail.com. Thank you.